Breast cancer treatment with radiotherapy can induce late radiation toxicity, which is characterized by pain, fibrosis, edema, impaired arm mobility, and poor cosmetic outcomes. Hyperbaric oxygen therapy has been proposed as treatment for late radiation toxicity. However, high-level evidence of effectiveness is lacking, as HBOT is standard treatment and reimbursed by insurers. Performing classical randomized controlled trials is difficult. The hyperbaric oxygen therapy on breast cancers patient with late radiation toxicity, they have one trial, which is called HONEY trials. So HONEY trials aims to evaluate the effectiveness of HBOT on late radiation toxicity in breast cancers patient using the trials within cohort design. So what's the method of HONEY trial? The method of HONEY trial will be conducted within the outreach cohort from multiple breast cancers intervention studies and long-term evaluations. Within Umbrella, breast cancer patients referred for radiotherapy to the University Medical Center's outreach are eligible for inclusion. Patient consent to collections of clinical data, patient-reported outcomes, and provide broad consent of randomizations into future intervention studies. Patient who meet in the HONEY in and exclusions criteria, participation more than 12 months in Umbrella, moderate and severe breast or chest wall pain, completed primary breast cancer's treatment, expected hormonal treatment. No prior treatment with HBOT, no contraindications for HBOT, no clinical signs of metastatic or recurrent disease. That will be randomized to HBOT or control group of ratio is 2:1. Patient in control group will not be informed about participations in the trial. Patient in the interventions arm will undergo 30 to 40 HBOT treatment sessions in a high-pressure chamber, which is 2.4 atmospheric absolute, where they inhale 100% oxygen through a mask. Cohort outcomes measures, which is physical outcomes, quality of lives, fatigue, cosmetic satisfactions of the HBOT group will be compared to the control group at 3 months follow-up. The pragmatic trials within the Umbrella cohort was designed to evaluate the effectiveness of HBOT to late radiation toxicity in breast cancer patient using in the TWIST design. Use of the TWIST design is expected to address issues encountered in classical randomizations controlled trials, such as contaminations, HBOT in the control group, and disappointment bias, and generate information about acceptability of HBOT. So that's all for today. Thank you so much for listening my session. I hope you guys enjoy a lot.